Hi there. In this video, we're going to look at the Manage Recall page, and this one, we're looking at the options on the right-hand side. Some of these are things you're hopefully familiar with, like one-off tests or regular tests, and they're available on the right-hand side of all our templates. Some things are much more specific and don't appear anywhere else. So to talk you through some of them, cancelling patient-specific requests. This is looking at things like one-off requests that have been added for a patient, meds that have been started and then need monitoring, but perhaps they've then decided to stop that medication. So if you click on this, it will take you through and show you what information is available. It will show you what things can be cancelled and take you through stage by stage. If there are multiple things that need cancelling, like here, for example, it's brought that up as a further one. I might want to say no to that. And then I can quickly put in what the reason is. If I put other, it will just leave it as blank. And yeah, it says save and re-retrieve because, again, that's the thing about status alerts, not updating immediately. The other option is I can just right-click and reevaluate alerts. Sometimes you have to do that a few times for all the changes to take effect. Then we've got sections about invites or booking appointments. So we've got invite for annual review, book annual review, invite for monitoring, book for monitoring. There are various places to kind of access those things as well. And generally they will work out what the invite needs to be, whether it should be by text or sending an appointment link or a letter, and it will code it and so on. We've got some quick options here, like if a patient is unable to receive links, so perhaps they've got a mobile but it's not a smartphone. We can also record if a patient regularly has bloods elsewhere, in which case we might be wanting to check for bloods on ice before we invite patients. We've got decline, delay, and exclude. This section is a sort of slightly softer approach where, depending upon what the indication is for the monitoring, it may or may not always stop it. So if, for example, I try and decline the annual review, it's giving me some information to read to the patient. Let's say, no, I'm not sure. Or if I want to delay the monitoring, depending upon what's going on, it may not be possible. So here it's saying that they've got high-risk indicators, DMARDs that need frequent monitoring or new things that have been initiated. Basically, just because a patient says they can't come in or wants to delay the monitoring doesn't necessarily mean it's safe to do that. So for this one, annual reviews can be delayed, but the high-risk drug monitoring can't be. And if you want to do that, it needs to be using the stop recall page, and that really needs clinical oversight. There are things, though, like if someone has had traumatic amputation of both feet, then that would stop them from showing up as needing an annual foot check. There are various things. We've tried to put some notes in that explains what's the impact of recording these particular options. You've got housebound status. Again, there's sort of quick entry or links to our more detailed templates that show more of what's going on. Finally, on this page, you've got things like if patient has a hemolytic disorder, so they need fructosamine instead of HbA1c. Ticking that will record that and update the recall. You've got things like B12 recall. You can put started and then put how often they're having it. It will default to 12 weekly. I assume it's that, but sometimes patients need it more frequently. In time, I think we'll make this a bit more detailed and put more information in here. Most of the time, most people in your practice won't be using this, but it may be if there's particular things you need to change for a patient, this is the place to do it. So again, you've got things like, if a patient's no longer on contraception and you want to record that, or if MGUS monitoring is now in secondary care, or things like that, or high-risk drug monitoring, this is the place to come and record it. And if you save the record, go back in, you should be able to see what the impact of those changes are. Thanks.